The carpal tunnel is a narrow channel within your wrist. The tunnel protects the median nerve and the tendons that help flex your fingers. If there is pressure or irritation of the median nerve, it can cause pain and weakness in your wrist and hand, and numbness or tingling in some of your fingers. The following health conditions can also lead to carpal tunnel syndrome in some individuals: inflammation and swelling of the tendons of the wrist, injuries to the wrist that could be from a strain, sprain, dislocation, or fracture, hormone or metabolic changes such as pregnancy, menopause, or thyroid imbalance, fluid retention, for example, during pregnancy, diabetes, certain medicine use, for example, steroids, and also degenerative and rheumatoid arthritis. Carpal tunnel syndrome usually starts gradually in the palm of the hand and fingers. Often, the symptoms are more evident during the night, and individuals often report the symptoms wake them up in the middle of the night. As the condition worsens, the symptoms are noticed during the day and are often worse when holding items such as dishes or a hairbrush. If the pressure of the nerve continues, the symptoms may start to last longer with little relief. You may find that you drop objects unexpectedly or have a weakness in your grip. Depending on the causes of your carpal tunnel syndrome, your therapy program may include education regarding changing wrist positions, proper neck and upper back posture, safe use of sharp utensils, tools, or other implements if sensory changes are identified, and stretch breaks during your work or daily routine. Your therapy program might also involve exercises to increase the strength of the muscles in your hand, fingers, and forearm, stretching exercises to improve the flexibility of the wrist, hand, and fingers, use of heat and cold treatments to relieve pain, use of a night splint to reduce discomfort, and changes to your work area. For example, if you sit at a desk and work on a computer, it's important for the keyboard to be in proper alignment to help avoid working in a bent wrist position. Your therapist may suggest increasing the size of tool and utensil handles by adding extra material for a more comfortable grip. Anti-vibration gloves or anti-vibration wraps around tool handles, if vibration is a factor at your workplace, may also be recommended. Your physical therapist will also consider your home and leisure activities, with recommendations such as wearing gloves to keep the wrists and hands warm and limiting sports that aggravate the condition until your symptoms resolve. The goals of physical therapy are to reduce your symptoms without the need for surgery, to enable you to be as active and function as possible, and to help you resume your normal work, home, and leisure activities. If you do end up having surgery, scar management to keep the skin supple and flexible will also be added to your treatment plan. There are ways you can help prevent carpal tunnel syndrome. Most people use more force than they need, so try relaxing your grip to avoid muscle fatigue and strain. For prolonged handwriting, try using a larger handle pen or soft gel grip. When doing repetitive activities, give your hands a break by performing the following stretching exercises once in a while. If possible, alternate your hands when completing some tasks. Here are a few stretches you can try if you think you may have or might be at risk for carpal tunnel syndrome. First, use your unaffected hand to bend the affected wrist up as shown. Keep the elbow straight on the affected side the entire time. Next, use your unaffected hand to bend the affected wrist down as shown. Keep the elbow straight on the affected side the entire time. Now, grasp your hand and bend it towards the thumb side as shown. The last stretch you can try is grasping your hand and bending it towards the little finger side as shown. Try and hold each stretch for 15 to 30 seconds for 3 to 5 reps. Here are a few additional tips to help prevent carpal tunnel syndrome or relieve symptoms if you already have carpal tunnel syndrome. Avoid bending your wrists by keeping them in a neutral position. This means your wrist should not be bent up or down. Make sure your workstation fits your height, posture, and the task required. Simple adjustments can help avoid unnecessary strain. Make sure your posture is appropriate to the task you are performing. Believe it or not, proper alignment of your spine, neck, and shoulders can prevent excessive strain and improper positioning of the wrist and hands. If you need additional information on your posture, go back and look at our PT Tip of the Week on January 23rd. You are more likely to develop hand pain and stiffness if you work in a cold environment. Try wearing gloves to keep your hands and wrists warm. Last but not least, staying physically fit and maintaining a healthy weight may help control diseases and conditions that may contribute to the onset of carpal tunnel syndrome.